Hey, little man. Yeah, I'm Captain because I was in the war with your daddy. We were both in what they call the Hotel Saigon. Really tough. And your dad, tough son of a bitch, both made a promise to each other that, if one of us didn't make it, then the other one would go back and go to their families and let them know how much they thought about him, how much they cared about him and loved him. And, unfortunately, Daddy didn't quite make it. But he gave this to me to give to you. He told me a lot about you, how much he loved you and all that. It's a watch that your great granddaddy got before he went off to the Civil War, fight with the Union, war to free the slaves, preserve the Union, whatever. Try to stay out of politics. And he was at the Battle of Antietam, the bloodiest day of fighting in the entire war. And unfortunately, your great granddaddy didn't make it. And so they wrapped up his personal effects. They took that watch that he had bought in a little dime store, his war watch, gave it back to his wife. And she was sad, some people are when people die in wars. And she still thought that watch was special, so she gave it to her oldest son. And he was wearing that watch when he went off to fight the war, the old wars, World War I. And he was in the Battle of the Bulge, big, great war. But he didn't make it either. And so that watch was put inside his personal effects and sent back to his family. His wife got that watch. And she too, she gave that little dime store watch to her oldest son. And when he went off to World War II to fight for his country, this great country, he wore that watch, going up against the Nazis, fighting for freedom with that war watch. But he made it through most of the war until the D-Day landing, storming the Normandy cliffs. He was wearing that watch when he died for this country. And they wrapped that watch up, sent it back in personal effects to his family. And he wasn't married, so they gave it to his mother. And she kept it, gave it to her oldest grandson, who went off to fight in Korea. He also didn't make it. That watch, it came back. Kind of a pattern that was kind of developing with that watch. People would wear that watch and they would die. But they kept giving it to son, so that's just one of your family traditions. And that young lad went off to die in Korea. And he was married though, and he came back to his wife came back with the personal effects. And that watch was given to your daddy. Looks just like you. The same smile, the same look. He had that watch when he went off to Vietnam. That was where we met, in Hotel Saigon. And he would tell me about you every day. And he was scared that those Vietnamese soldiers was going to take his watch. So he had to hide it. Hid it in the only place that he could. He stuck up his ass. He kept that watch in his ass. He didn't want him to take it. It was going to be your birthright. watch stayed in his ass, and he basically caught dysentery. Eventually killed him. When he died, I reached my hand in his ass, and I grabbed that watch. And I put it in my ass, and I hid that watch, because I knew that now I had to be the guy to survive and bring that watch back to his family to let him know how much he loved. Damn it. Also you. How much he had fought to make this a better place. And unfortunately, he didn't make it. And so now, the war is over, and I got out of Hotel Saigon. I made my way to your house. And now, son, I'm giving that war watch.
A recent survey conducted by the Council for a Strong America had concluded that, nationwide, 77% of youth between the ages of 17 and 24 cannot qualify for military service, an increase from 2017's already troubling ineligibility rate of 71%, or just a mere 23%. Less than a quarter of age-eligible Americans are even fit to serve in the uniformed military, making those who do, representing less than 1% of the entire population, contrary to popular myth, truly the best of the best that this nation has to offer. Not surprisingly, being overweight disqualifies 11% of youth from serving if they so choose, and contributes to the 44% of youth who are disqualified for multiple reasons. Or, almost half of Americans, despite an emphasis on healthy living, are not ready to be that lean, fighting machine, or ready to be all that you can be. And the remainder suffer from a failure to attain the academic standards even to begin training as a grunt, or infantryman among the few, the proud, the US Marines or in the US Army, as well as face challenges because of a criminal record, which does not reflect well upon those who are simply unfit to serve in uniform. And, at least according to the public relations propaganda and marketing, the mission for the Department of Veterans Affairs is to fulfill President Lincoln's promise to care for him who shall have borne the battle, and for his widow and his orphan, by serving and honoring the men and women who are America's veterans. And, according to VA Secretary Dennis McDonough, our department remains fully committed to fulfilling the sacred obligation that we have to those who serve in uniform. According to the Department of Veterans Affairs, they rely upon their core values to accomplish their mission and inform every interaction with our customers, and these core values are integrity, commitment, advocacy, respect, and excellence, better known as I Care. According to the Department of Veterans Affairs, these core values will continue to serve as the right guide for all our interactions and remind us and others that I care. They say, I care about those who have served. They say, I care about my fellow VA employees. They say, I care about choosing the harder right instead of the easier wrong. They say, I care about performing my duties to the very best of my abilities. The Veterans Care Facilities users include 9.2 million veterans of the U.S. Armed Forces and 1.7 million who are family members of disabled veterans. And yet, according to the Center for Infectious Disease and Policy, or CIDRAP, at the University of Minnesota, the population of users for care facilities managed by the Department of Veterans Affairs are mostly men, more than 85%, compared to 49% of the general U.S. population, with an average age of 61, and, notably, VA users were mostly white, 73%, compared to 61% of general population. And, even before the recently terminated pandemic emergency, the expected death rate among active users of VA healthcare was approximately 26% higher than in the general U.S. population, which is not a ringing endorsement for this model of universal healthcare for all, or the core values, focused on I Care statements that are promoted at the Department of Veterans Affairs, most notably during the recently terminated pandemic emergency. In a recent cohort study, by Dr. Daniel Weinberger, published in JAMA, the Journal for the American Medical Association, they had compared 10.9 million enrollees in the Veterans Health Care System, including 6.8 million active users, or those with a visit in the last 2 years, in head-to-head comparison with the general population of the US, with deaths occurring from January 1, 2014, to December 31, 2020, the very first year of the pandemic declaration. This statistical analysis was conducted from May 17, 2021, to March 15, 2023. In this study, because the pre-pandemic standardized mortality rates were higher in the VA populations prior to the pandemic, the absolute rates of excess mortality were higher in the VA populations, or, simply stated, because veterans were dying at a higher rate before the pandemic, there was, according to this peer-reviewed study, no indication that the Department of Veterans Affairs had improved outcomes during the global public health crisis, and, like the national picture of fatalities. During the COVID-19 pandemic, amongst users of the veterans care facilities, the relative increase in deaths was smaller in the white population than in other racial and ethnic groups. And senior officials at the Department of Veterans Affairs today hail as a success the findings that this cohort study found that the relative association of the COVID-19 pandemic with all-cause mortality was similar between the general US population and users of the VA health care system. Or, in other words, there was no decline in the quality of care given to veterans during the pandemic from the care that had been given before the pandemic declaration, when the expected death rate among active users of VA healthcare was approximately 26% higher than in the general US population, which is not a ringing endorsement for this model of universal healthcare for all, or the core values, focused on care statements that are promoted at the Department of Veterans Affairs, most notably during the recently terminated pandemic emergency. The Department of Veterans Affairs, caring for those who had been identified by President Biden as the very backbone of America, manage a total of 134 facilities, 128 of which are identified as acute care facilities, and 132 of which are identified as long-term care facilities, and, according to the press release published by their Public Affairs Office, after the emergence of a novel coronavirus had been reported by officials in Beijing on December 31, 2019, on January 4, 2020, the Office of Emergency Management notified Veterans Health Administration, VHA, senior leadership and began tracking a pneumonia of unknown origin with 40 cases surfacing in China, which may suggest a leadership getting ahead of the power curve, but this was just 40 cases of infection from what had been described as a pneumonia of unknown etiology, or origins, in a nation with over 1 billion in population, in a city with a population of between 8 and 11 million, the 42nd largest city in the world, the 7th largest city in China and the largest city in the central mainland, with as many as 27 cases of the novel coronavirus associated with the Huanan wholesale seafood market, a venue the size of 9 American football fields, according to the Wall Street Journal, and there would not be even one death in China reported until January 10, 2020, 6 days after the Office of Emergency Management and senior leadership at the Veterans Health Administration were already in a panic mode response, raising reasonable questions. The first reported death in the state of Washington would not occur until February 29, 2020. It was not until January 20, 2020, that the first U.S. COVID-19 case was confirmed in Washington state, a traveler to Wuhan who had failed to have infected a total of 68 close trace contacts, on a 20-hour flight, during a 25-mile share ride from the bustling Seattle-Tacoma airport, or during the course of 4 days ambling about the Puget Sound area, but, baffling scientists still today, his unique strand of virus, which could only, by timeline, have been acquired in Wuhan, had been found in 39 other cases throughout the entire state, persons with whom that initial case had had no contact or connection, suggesting that the infections were not transmitted from person to person, but rather had been associated with the same batch of a biological agent, a reasonable suspicion that was never raised by officials at the Department of Veterans Affairs. Applauding the efforts of their leadership, according to the press release from the Veterans Administration officials, on March 10, 2020, the day before the pandemic declaration, VA stopped allowing visitors to enter its 134 nursing homes and 24 major spinal cord injury and disorder centers, effectively implementing a national lockdown in the veterans' healthcare system, and they highlight the fact, to endorse their proactive approach, that the CDC still considered COVID-19 to be a low threat to the US in early March, but VA believed this step was needed to reduce the risk that these older and more vulnerable veterans could be exposed to the virus. Yet, today, there have been 872,835 infections amongst users and employees at veterans' care facilities, with as many as 12% of those cases amongst veterans being reinfections, 2, 3 or more, suggesting that this population appears to be prone to coming into contact with the virus at a higher incidence than some others. And, with not even one mention in the press, 10,674 inpatient residents, average age 70, had succumbed to COVID-19, primarily arising in facilities that serve communities of color, but somehow the leadership for the Veterans Administration had failed to notice a quite obvious breach of their wall against infections, or acknowledge that their lockdowns had quite evidently failed, in facilities where, before the recently terminated pandemic emergency, the expected death rate among active users of VA healthcare was approximately 26% higher than in the general US population, which is not a ringing endorsement for this model of universal healthcare for all, or the core values, focused on care statements that are promoted at the Department of Veterans Affairs, most notably during the recently terminated pandemic emergency. Since Veterans Day 2021, when the President had failed to take notice of the mounting fatalities associated with facilities managed by the Veterans Administration at the wreath-laying ceremony at Arlington Cemetery, Major Mike Webb has been pressing senior officials to hold them accountable for the failures in care to America's veterans during the pandemic declaration, demanding a physical inspection of the facilities in East Orange, New Jersey, about which Senator Cory Booker had raised alarms when he had been running for president in June 2020, but which issue he quickly forgot once his presidential aspirations were foreclosed. Major Mike Webb has demanded the same of Congresswoman Eleanor Holmes Norton in the nation's capital, regarding the Veterans Care Facility in the district she represents, and called to task Congressman Don Payne, Jr., of Newark, and Congressman Don Bayer, Jr., of Northern Virginia, and Senators Mark Warner and Tim Kaine of Virginia, regarding the neglect of the nation's veterans during the pandemic, with no response. And highlighting these past failures, more than just talk the talk, Major Mike Webb took the Veterans Administration to court in a federal case, challenging the masking mandates still in place at the veterans' care facilities, non-medical grade substitutes that the National Institutes for Occupational Safety and Health over a decade ago, during the Obama administration, had definitively determined would be wholly ineffective during a respiratory tract infection pandemic, an evidence-based clinical conclusion regarding any disease, not just COVID-19, that medical experts at the Veterans Administration chose to reject. Some talk the talk, but Major Mike Webb walks the walk. Some say they stand with the veterans, but Major Mike Webb stands up for veterans. Mission first, and men always before himself.
And now, son, I'm giving that war watch to you.